Very much for asking me about influenza. This is turning out to be a very serious year in terms of the flu. We don't know if the flu and the numbers have peaked yet. We certainly are seeing significant numbers of ill patients really throughout Pennsylvania, particularly in the Southwest, but really throughout our state. The flu is a very serious viral illness. This strain of the flu can produce very significant symptoms, and so the most important message is that it still is not too late to get a flu shot. And the flu shot is the best way for an individual to protect themselves and their family from the flu. You can obtain the flu shot usually free with insurance and Medicaid and CHIP, etc., at your doctor's office, at clinics, and at most pharmacies and grocery stores that have pharmacies. And so that is the single most important message. The next important message is if you think someone has the flu, especially if they're having severe symptoms, call your doctor early. Call your doctor early because the medicine, Tamiflu, the antiviral medicine, can be very helpful in terms of limiting how serious and significant the flu symptoms are and how long they last. But by far the most important thing is if you haven't gotten your flu shot by now, get it now.
And is it a good match to the predominant strain?
Well, so we'll see at the end of this year how good a match it was. There were suggestions from studies in Australia, which sees the influenza before we see it, that it wasn't a fantastic match. But even if it's not a great match, it still can decrease how severe the flu symptoms are and how long they last in patients, even if it doesn't match up perfectly.
And are there any shortages of Tamiflu?
There are no current shortages of flu vaccine or Tamiflu at the present time.
And does the strain or the predominant strain seem to be hitting certain age groups more than others?
It does seem to be hitting young people, children, very severely. This is the H3N2 strain, which is of influenza A that we're predominantly seeing. And it does seem to have hit young people very hard. But of course, there are other people that are very susceptible to severe symptoms of influenza. That includes senior citizens, that includes infants and children, and it includes individuals that might have other medical conditions such as heart disease, lung disease, kidney disease.
And is this the worst flu season since the swine flu year?
So what we're hearing from the CDC nationally is that this does seem to be the worst flu season since 2009. We don't have that specific data available in Pennsylvania yet, so we're still watching our statistics.